If you are over 60, there is a good chance you are paying attention to your blood pressure, your cholesterol, your blood sugar, your medications, maybe even your daily steps. But there is one thing many people overlook for years, and sometimes for decades. It is what your body is doing for 7 or 8 hours every single night. Most people never realize that the way they sleep may be making nighttime blood pressure, breathing problems, reflux, swelling, and circulation issues worse. And when those problems keep repeating night after night, they can quietly add stress to the heart, the blood vessels, and the brain over time. That does not mean sleep position is a miracle cure. It is not. It does not mean changing your pillows replaces medical care. It does not. But it does mean something important. The way you position your body at night can either support better breathing, better comfort, better drainage, and steadier sleep, or it can make several common age-related problems harder on your system. Tonight, I want to walk you through 8 common sleep positions, from worst to best, and then I am going to show you one practical setup that many older adults can try starting tonight, especially if they deal with reflux, snoring, poor sleep, comfort, swelling, or that worn-out feeling in the morning that seems to have no clear explanation. I'm Dr. Caleb Rowan, and if you often wake up puffy, dizzy, short of breath, heavy-legged, or more tired than when you went to bed, stay with me, because this may explain more than you think. To understand why sleep position matters more after 60, we have to start with something simple and very human. The body still knows how to heal, regulate, and restore itself with age, but it does not tolerate mechanical stress the same way it did at 25. Blood vessels gradually become less elastic. Muscles, including the muscles that help posture and breathing, are often weaker. Many people have some degree of reflux, arthritis, shoulder pain, hip pain, snoring, mild sleep apnea, fluid retention in the legs, or nighttime urination. Some people notice their rings feel tight in the morning. Others wake with a dry mouth, a headache, a racing heart, or a strange sense that they did sleep, but they did not recover. That is where sleep position comes in. It can influence how open your airway stays. It can influence whether stomach acid is more likely to creep upward. It can affect whether your neck is twisted for hours, whether your shoulder is compressed, whether your lower back is strained, and whether fluid is allowed to collect more in the lower body. It can also change how restful sleep feels, and that matters because poor sleep is not just an annoyance. Poor sleep is associated with higher stress hormones, worse blood pressure control, more inflammation, lower daytime energy, and worse recovery overall. This is especially relevant in older adults because nighttime physiology is not passive. Your blood pressure should normally dip during sleep. Your breathing should stay stable. Your heart should not be fighting repeated arousals, drops in oxygen, or unnecessary physical strain from a position that your body no longer tolerates well. If you snore heavily on your back, if you wake with acid in your throat, if one shoulder goes numb, if your legs feel thick and heavy in the morning, or if you feel your heart beat when you lie a certain way, your body may already be telling you that your setup is not working. So let us rank these positions the way I would explain them in clinic. Not with fear, not with internet drama, but with practical reasoning. And as we move through them, remember this. The question is not which position sounds best in theory. The question is which position gives your body the least resistance and the most support for the problems you actually have. At number 8, the worst position for most older adults is stomach sleeping with your arms up overhead. Some people end up here because it felt comfortable years ago. Some people drift into it without realizing it. But after 60, this can be a punishing position. When you sleep on your stomach, your neck has to rotate to one side for a long stretch of time. Your upper chest can feel restricted. Your shoulders are often put into a strained, elevated posture. If your arms are up, you may be compressing nerves around the shoulder and chest even more. That can leave you waking with numb hands, shoulder pain, neck stiffness, and poor quality sleep. From a breathing standpoint, stomach sleeping is not ideal for many older adults because it can make the rib cage and diaphragm feel less free. You may not notice this as dramatic shortness of breath, but you may notice restlessness, more tossing and turning, or the feeling that you never settle deeply. If you already have arthritis in the neck, rotator cuff irritation, upper back tension, or a tendency towards shallow breathing, this position often adds to the problem. And when sleep becomes lighter, more interrupted, and less restorative, the next day usually tells the truth. You wake foggy, you are more irritable, your body feels stressed before the day even starts. Now, does stomach sleeping directly cause a stroke? That is too strong, and I would not say that. But I will say this clearly. It can worsen several conditions that are already linked to cardiovascular strain, including poor sleep quality, breathing discomfort, repeated arousals, pain, and elevated stress on the body overnight. If you are a committed stomach sleeper, do not panic, but understand that this is usually not the position I want an older adult to build a healthier sleep routine around. At number 7 is sleeping flat on your back with no elevation at all. This one surprises people because back sleeping sounds neutral, clean, balanced, almost textbook. And for some people, especially younger adults without reflux, snoring, or airway issues, it may be fine. But in older adults, completely flat back sleeping can create real problems. If you are someone who snores, or someone whose airway gets narrower at night, lying flat on your back may allow the tongue and soft tissues of the throat to fall backward more easily. That can make breathing noisier, more fragmented, and in some cases contribute to positional sleep apnea. It also tends to make nighttime reflux worse in people who are prone to it. If you have ever gone to bed feeling okay, and then woken up with burning in the chest, a sour taste, coughing, throat clearing, or the feeling that food is sitting in your upper stomach, you know exactly what I mean. And when breathing is worse or reflux is worse, sleep quality usually follows. You may wake more often, get less deep sleep, and feel more drained by morning. Some people also notice more swelling or stiffness when they stay completely flat for long hours. If you absolutely love sleeping on your back, I am not telling you that you must never do it again. But I am telling you that completely flat back sleeping is often overrated in older adults, especially if you wake with snoring, reflux, dry mouth, morning headaches, or that heavy, unrefreshed feeling. In many cases, even a small amount of elevation changes the whole experience. Number 6 is right side sleeping. Now we are moving out of the worst group and into the middle. Right side sleeping is not automatically bad. In fact, for some people, it feels comfortable and stable. It may reduce the problems of stomach sleeping and may be more comfortable than lying flat on the back. But it is not always the best choice either, particularly if you struggle with reflux, certain nighttime palpitations, or shoulder and hip discomfort on that side. One thing many people do not realize is that a position can feel familiar without actually being restorative. I think of a woman I once counseled who told me she had slept on her right side for years and felt certain it was her safest position. But every morning she woke with one hand tingling, one shoulder sore, and a vague, uneasy sensation in her chest around 3 a.m. Her heart tests were reassuring, her labs were acceptable, yet she still felt wrong at night. We changed nothing dramatic. We simply reduced how tightly she curled, added support at the knees and behind the back, and encouraged her to spend more time on her left side instead. Within 2 weeks, the shoulder pain eased, the hand tingling improved, and she stopped dreading the middle of the night. That is what I mean when I say comfort and physiology do not always match. Right side sleeping is not a disaster. It is just often not the most helpful position for older adults who already deal with common nighttime complaints. If it is your natural position, I do not want you to force yourself violently out of it. I just want you to understand that there may be a better option. Number 5 is the tight fetal position on the right side. This is one of the most common ways people sleep, and it often starts because it feels protected, safe, compact. For some people, emotionally comforting. But when the body is curled too tightly, the chest may not expand as freely. The neck may flex too much. The shoulders may roll inward. The hips and low back may stay under tension for hours. By morning, you can feel wrung out, even though you never fully woke up enough to know why. This is one of those positions people rarely question because it feels natural. Yet it often goes with complaints like waking with a tight chest, waking stiff, waking with the jaw clenched, or waking with that odd combination of fatigue and soreness. If you sleep this way, and your knees are pulled very high, your chin is tucked toward your chest, and your upper body feels collapsed, your position may be reducing sleep comfort more than helping it. Again, I am not saying it is dangerous in every case. I am saying it is usually not ideal when the goal is open breathing, better alignment, and calmer sleep. Now we get to the turning point, where sleep position starts to help instead of merely doing less harm. Number 4 is left side sleeping without elevation. For many older adults, this is the first position on the list that begins to work with the body rather than against it. It can be especially helpful for people with nighttime reflux, mild snoring, or the feeling that they breathe easier and sleep more calmly on one side. There is also a long clinical tradition, supported by physiology and patient experience, suggesting that left side sleeping often reduces nighttime reflux compared with lying flat on the back or on the right side. It is not magic, it is mechanics. In many people, the angle of the stomach and esophagus seems to favor less backflow in this position. That means less burning, less throat irritation, less coughing, and fewer sudden wake-ups that break apart the night. Some people also report that their heartbeat feels less noticeable on the left side when the rest of the body is properly supported. Not everyone, but many. If you want to try this position, keep it simple at first. Lie on your left side with your head and neck in a neutral line, not cranked upward and not dropping down. If you roll onto your back easily, you may need something gentle behind you to keep you there. If your shoulder goes numb, that does not mean left side sleeping is wrong. It usually means you need better support and less direct pressure. That leads naturally to number 3, which is left side sleeping with gentle upper body elevation. This is where a lot of people suddenly understand why their sleep has felt harder than it needed to be. Gentle elevation can help in several common situations. It may reduce reflux symptoms. It may help some people who snore more when they lie flat. It may improve comfort for people who feel heavy in the chest after dinner or who wake up feeling congested or backed up. It is also often more comfortable than people expect once the body adapts to it. I am talking about gentle elevation, not sleeping bolt upright and not creating a mountain out of random pillows. Usually, a mild incline is enough. The goal is to support the upper body, so gravity is working a little more in your favor, especially if you are someone whose symptoms get worse when completely flat. This can be particularly useful for position-related breathing issues, mild nighttime reflux, and those nights when the body just feels better with a little help. And I want to pause here, because this is where many people make the mistake of doing the right idea in the wrong way. They stack 2, 3, 4 soft pillows under the head only. That often bends the neck forward too much, strains the upper back, and still leaves the torso basically flat. Then they wake up and conclude that elevation does not work. The truth is, the setup failed, not the concept. Once you understand that, you are ready for the next level. Number 2 is left side sleeping with strategic pillow placement. This is where sleep position stops being a vague theory and becomes a real system. Because the difference is not simply being on the left side, the difference is how the whole body is arranged. Start with a pillow between the knees. This matters more than many people think. Without it, the top leg can drop forward, twisting the pelvis and pulling on the low back and hips. That small misalignment can be enough to create discomfort, restless sleep, or morning stiffness. A pillow between the knees helps keep the hips more neutral and often takes pressure off the lower back. Next, give yourself support behind the back if you tend to roll onto your back in the middle of the night. A body pillow, a folded blanket, or a firm pillow behind you can help your body stay in the position you actually intended to sleep in. Then pay attention to the head pillow. It should be high enough to keep the neck aligned with the rest of the spine, but not so high that your head is pushed sharply upward. If you could look at yourself from behind, you would want the neck to look like a continuation of the spine, not like it is bending off to one side. If the lower shoulder feels compressed, you may also benefit from a small adjustment under the rib cage or a slight repositioning of the arm so you are not dumping all your weight into the shoulder joint. This is especially important if you have a history of rotator cuff pain, bursitis, or numbness in the arm at night. When those details are right, left side sleeping feels very different, not forced, not cramped, stable, supported, quiet. This is often the point where people tell me, I thought I knew how to sleep on my side, but I had never actually set my body up correctly, and that brings us to the number 1 position in the ranking, not because it guarantees anything, not because it prevents every cardiovascular problem, but because for many older adults it is the most supportive overall setup for reflux, snoring, swelling, poor sleep comfort, and those mechanical issues that keep stealing recovery. The number 1 setup is left side sleeping with gentle upper body elevation, strategic pillow placement, and a brief pre-bed leg elevation routine. In plain English, you are combining the most helpful elements into one practical system. You are not just picking a side, you are creating conditions that may make the whole night easier on your body. Here is what that looks like. First, the upper body is slightly elevated. This can be done with a wedge pillow that supports the torso or with the head of the bed raised in a stable way. Second, you settle onto the left side rather than flat on the back. Third, there is a pillow between the knees, proper support for the head and neck, and something behind the back if you tend to roll backward. Fourth, if your legs tend to swell during the day, or if you feel heavy and puffy at night, you spend a short period before bed with the legs elevated above heart level. That last piece is often overlooked, but it can be surprisingly useful for the right person. If you sit or stand a lot during the day, fluid can collect in the lower legs. A brief period of leg elevation before bed may help redistribute some of that fluid, and some people notice less heaviness, less ankle tightness, and even fewer overnight bathroom trips once they stop taking all that lower body pooling straight into the night. It is not a cure for edema, and if you have significant swelling, you need medical evaluation, but as part of a thoughtful bedtime routine, it can be very practical. The reason I like this number one setup is not because it sounds impressive, it is because it addresses several common nighttime problems at once. Left side positioning may help with reflux. Gentle elevation may help with reflux and position-related snoring. Strategic pillow placement helps alignment. Leg elevation may help some people with lower body fluid pooling. When one setup supports breathing, comfort, alignment, and symptom control at the same time, sleep often becomes calmer and more efficient. And calmer sleep matters. When you sleep more deeply and wake less often, the body gets a better opportunity to regulate blood pressure, maintain steadier breathing, reduce stress signaling, and support daytime function. That is the real promise here. Not some fantasy that a pillow arrangement replaces medicine, but the very real possibility that better mechanics can support better nights, and better nights can support better health. So how do you actually set this up tonight in the real world without turning your bed into a construction project? Let me make this simple. Start with the torso, not just the head. If you have a wedge pillow, use one that supports from the upper back through the head so your whole upper body is gently inclined. If you do not have a wedge, you can temporarily improvise, but avoid building a tall tower under your head alone. That usually creates neck flexion and disappointment. Then choose a medium-height head pillow that keeps your neck neutral. If you are unsure, lie down on your side and notice whether your nose is pointing straight ahead or whether your head is being shoved upward or allowed to droop downward. Next, put a pillow between your knees, not under one knee, between the knees. This helps the hips and lower back stay more comfortable through the night. Add a pillow or folded blanket behind your back if you tend to roll flat. If your shoulder feels jammed, bring the lower arm a little forward and consider a thin towel or soft support near the side of the torso to reduce pressure. Now for the pre-bed leg elevation. About 30 to 60 minutes before sleep, lie down and raise the legs above the level of the heart for 10 to 15 minutes if swelling or heavy legs are part of your pattern. You can use pillows, a wedge, or rest the legs against a wall if that is comfortable and safe for you. Breathe slowly. Let the body unwind. This should feel relieving, not stressful. If it causes discomfort, shortness of breath, or anything unusual, stop and talk to your clinician. If you wake during the night, do not obsess over doing everything perfectly. Sleep does not work well under pressure. Just reset gently. If you have rolled onto your back, return to your side. If the knee pillow slipped out, place it back. If the head pillow feels too high, adjust it. The goal is not perfection. The goal is better support, repeated consistently enough that the body starts trusting the position. There are also a few common mistakes I want you to avoid. The first is trying to change everything in one night and then giving up because it feels unfamiliar. Your body may need several nights, sometimes a couple of weeks, to accept a new position. That is normal. The second mistake is using too much elevation. More is not always better. If you are sliding, straining, or waking with low back discomfort, you may have gone too far. The third mistake is forcing left side sleeping when your shoulder, hip, or spine are not supported correctly. Discomfort usually means the setup needs adjustment, not that the whole idea is wrong. And here is the most important caution. If you have heart failure, atrial fibrillation, significant leg swelling, moderate to severe sleep apnea, severe shortness of breath when lying down, a history of stroke or TIA, uncontrolled reflux, or unexplained chest symptoms at night, use this information as a conversation starter, not as a substitute for personalized medical advice. Those conditions can change what is safe or appropriate for you. The smartest approach is to combine practical sleep positioning with proper medical care, not to choose one over the other. So what changes can you realistically expect if you improve your setup? In the first few nights, some people notice less reflux, less snoring according to a partner, or less aching in the shoulder, neck, or low back. Within 1 to 2 weeks, many people notice the position starts feeling more natural and they wake less often fighting the bed. Some describe clearer mornings, less stiffness, less puffiness around the face or ankles, and a more settled feeling in the chest or stomach at night. If you use a sleep tracker, you may even notice a steadier night, though I would not become overly dependent on gadgets. What I would pay attention to instead is what your body tells you. Are you waking fewer times to clear your throat? Are you getting up to use the bathroom less often? Do your legs feel lighter in the morning? Is your mouth less dry? Is your partner saying you are snoring less? Are you waking with more confidence and less dread about the night ahead? Those are meaningful changes, and they matter because they affect independence, energy, daily function, and quality of life. One more thing I want to say, because this is where people tend to talk themselves out of helpful change. They say, I have slept this way for 40 years, so changing now must be dangerous or pointless. Not necessarily. Familiar is not always the same as beneficial. The body can adapt to a poor setup so gradually that discomfort starts feeling normal. You assume everyone wakes stiff. You assume everyone needs an hour to feel human. You assume everyone over 60 snores, coughs, clears their throat, or wakes twice to use the bathroom. Sometimes that is true, but sometimes those patterns are being amplified by the way the body is positioned every single night. I have also seen the opposite mistake, which is chasing the perfect position instead of building a sustainable one. If left side sleeping is clearly aggravating one injured shoulder, that does not mean you failed. It means you modify. You may need a softer mattress topper, a better shoulder angle, a different head pillow, a small towel under the side of the rib cage, or a partial side lying position instead of a strict one. The goal is not to win a sleep position competition. The goal is to create the most supportive setup your body can tolerate consistently. In medicine, the best plan is often the one a person can actually live with, and do not underestimate timing. If you eat a heavy meal late, then lie flat. Reflux is more likely to bother you no matter how good your pillows are. If you drink a large amount of fluid right before bed, your sleep may still fragment from bathroom trips. If you fall asleep in one position but spend the last 5 hours on your back, your morning symptoms may still reflect that. In other words, position matters most when it becomes part of a broader rhythm. Lighter, late evening meals, enough time to digest, a calmer wind down, and a bed setup that helps your body stay where it sleeps best. This is why I care about a subject like sleep position. It sounds small until you remember that sleep is 1/3 of your life. 1/3. If your body is spending those hours in a way that makes breathing harder, reflux worse, alignment poorer, and recovery weaker, the cost adds up. And if a few thoughtful adjustments make those hours gentler and more restorative, the benefit adds up too. So here is the challenge I want to leave you with. Give this a real trial, not a one-night experiment. For the next 30 days, aim to sleep on your left side with gentle upper body elevation if it is comfortable for you, and use the pillow supports we discussed. If swelling is one of your issues, add the short pre-bed leg elevation routine. Then watch what happens. Track how often you wake up at night. Track whether your morning swelling changes. Track your reflux, your snoring, your shoulder comfort, your mental clarity, and how steady your energy feels when the day begins. And remember, sleep position is not a replacement for blood pressure treatment, reflux treatment, sleep apnea treatment, or stroke prevention plans from your doctor. But it may be one of the most overlooked lifestyle levers in older adults, especially those dealing with nighttime discomfort that has quietly become normal. Sometimes the body does not need a dramatic intervention first. Sometimes it needs less strain, better support, and a setup that finally makes sense. If you decide to try this, tell me in the comments what position you usually sleep in and what you notice after a few nights. And if this kind of practical, evidence-aware guidance is helpful to you, subscribe and stay with me, because there is a lot more to talk about when it comes to sleep, circulation, heart health, and protecting your quality of life as you age. You may not control every risk factor that comes with getting older, but you can control how your body spends 1/3 of its life every night. And that makes tonight a very good place to start.